majority in Europe, with 9,179 fatalities. More than 1 billion people have been asked to stay at home in more than 50 countries across the world as governments
louder for a nationwide lockdown to tap
the country on the lockdown. The country has intensified its battle against novel corona.
tally has neared the 76 lakh mark
To
in the
check the
country.
state of COVID-19.
That could also escalate the spread of COVID.
When the world came to a halt, India stood at the edge of uncertainty. We had hospitals, we had doctors, but we lacked the very tools we needed to fight back. In the middle of this global chaos, India faced a critical shortage of medical devices. At a time when India relied heavily on imports, a new model was emerging in Visakhapatnam, the Andhra Pradesh MedTech Zone, built to manufacture, test, and scale medical technology. An ecosystem designed to bring together infrastructure, regulation, and manufacturing in one place. When the crisis arrived, it was ready.
I could see how Andhra MedTech Zone was helping in the crisis, especially when lockdown happened over there. So there were just, I think, hardly 4 or 5 factories that time in India making ventilators.
We were supposed to develop ventilators, and we had a huge target to manufacture thousands of ventilators and supply that to the government of India within a very short time span. And with the help of the AMTZ team, with the help of Dr. Sharma, we were able to navigate through, cut across multiple barriers, multiple hurdles that we face. The pandemic created disruptions in our supply chain.
A couple of them were invited over to Vizag initially, and then later on a third company also came over there. And they were assisted by AMTZ to completely scale up with manpower, with inputs, with the testing, with all those facilities.
We were starting the day very early in the morning, and the AMTZ team as well as our own team, we are working at the factory till late in the night.
It was just walk in, welcome, and we'll support you. Just give us your know-how, your technology, how you make the ventilator, and we'll provide the full eco support system for getting the components and everything to scale up. And that's how India fought the war.
Driven by one simple goal, we had to stand up and support the country at the time it needed the medical devices the most.
So later on, when testing started, when they came to know how to test for COVID and the RT-PCR tests and the other tests which were required, again the same thing happened over there. Manufacturers who had that competency were given the opportunity and infrastructure from AMTZ to scale up rapidly. And other things like PPE kits and other medical electronics, thermometers and stuff like that over there.
We produced millions of diagnostic kits a day. India was consuming 10 to 12 lakh RT-PCR test kits every day. AMTZ campus alone during COVID built up a capacity to produce about 10 lakh kits a day.
Spokesman for India's Foreign Affairs Ministry appreciate the shipment of vital medical supplies, including 100 ventilators and 95 oxygen concentrators.
The pandemic didn't create this problem, it exposed it. To understand why, we have to look at how India's medical technology journey began.
It was very primitive. We were depending upon a lot of things. We were depending upon very, very primitive things. Like say for example, I tell you that an otoscope, they used to see the otoscope with the sunlight in the ear. So that was the time when, we saw those times when it was very, very primitive. The ecosystem which we got here are, they must have thought everything. They must have thought, okay, we don't require only a factory, we require the other ecosystem along with it. And the hand-holding which is there. If such type of medical zones are done, Even if the other zones copy this zone, even that will make a lot of difference as far as the medical equipment is concerned. And I'm telling you, as I've told you,
India is today 63% import dependent. We are roughly importing about 60,000 crore worth of medical devices.
For decades, India depended on the world for even the most basic medical tools.
After so many years of independence, still we are dependent on simple things.
Indian exports are growing at the rate of 14%, and Indian imports are declining at the rate of 3 to 5%. If this is projected, India will be import neutral. We would be exporting as much as we are importing by about 2030 to 2033. Perhaps with more rigor, more effort, this can be preponed. But we are on a good track.
Everybody feels now elated that now time has come, that now not only that we are working for import substitution, but we are working for high-end medical equipments, including MRI, ventilator, oxygen concentrator, to the auto analyzer, to be made in India for self-sufficiency in India as well as for the export in advanced countries. I would say there are 3-4 important reasons for this success. One is the vision of the CEO, Dr. Jitendra, and the second thing is the entire team which working with him, total dedicated team, right from his colleagues to manager to person and technician. And the third is those investors, those industries, those partners who have reposed the faith in them and then have come and invested money.
AMTZ's cluster turnover today is roughly about 15,000 crore. India's medical devices market is about 80,000 crore. So you can say that about 20% of Indian market, medical devices market, is represented by AMTZ.
The ecosystem which is being created by AMTZ for encouraging made in India equipment is, I think, phenomenal. The confidence which is being generated on made in India products is entire changed ecosystem.
In less than a decade, AMTZ had become a cornerstone of India's medical device ecosystem.
AMTZ-like institution has never happened anywhere in the world.
So internationally, I had seen that you've got clusters globally, like you've got Tuttlingen in Germany. Even Pakistan has a Sialkot for surgical instrumentation. In China, there are so many cities which are product-specific clusters. India, we had natural clusters which were existing.
Portions of AMTZ has happened in some parts of the world, like Ireland, like China, like Boston. It has happened. Endeavor to make AMTZ was, can these portions which have happened in a scattered way, like medical electronics in China, diagnostics in the US, orthopedics and implants in Germany, and so on.
Globally, medical technology clusters existed in fragments.
Can it be done in an aggregated and scale-up manner? And therefore, our belief came from the fact that disintegrated smaller versions of this has happened in some parts of the world. The aggregated version has not happened, and there is no reason why an aggregated version cannot be done. That's where our belief came from.
AMTZ set out to bring them together at scale.
When I met Dr. Jitendra Sharma sir in 2017, we were looking to set up a stent manufacturing facility. We went to his camp office in Vizag, and all he had was a vision. And he showed his vision, which was brilliant. But when we went to the ground where AMTZ was supposed to take shape, there was only a metallic gate and there was nothing behind it. It was a large forest. And it was very hard to believe the vision at that point. But In 2019, when I went back, exactly 2.5 years later, I was absolutely delighted because when you go to AMTZ, you see buildings that are built in days, not months. There are several buildings that have built in 82 days, built in 67 days. The entrepreneurial drive and the energy in AMTZ is unbelievable. Dr. Jitendra Sharma sir shaped the thought process of the medical device industry in more ways than one, and I'm saying this without fear or favor.
Speed mattered, but infrastructure was only the beginning. What truly powered AMTZ was its focus on startups.
For us, collaborations with hospitals, getting one sample earlier was also a big thing.
Before coming to AMTZ, we have tried to set up our incubation or being an incubator or incubatee in multiple places.
What you require as a startup? You require equipments, you require infrastructure, capex funding, you require that your licenses gets complete on time, and market access.
Most startups don't fail because of lack of ideas. They fail because the system around them is too complex.
Because too many startups come with a good idea, but the problem that they face is the regulatory part. Because unless you are regulatory cleared, you can't go into the market.
When a researcher comes, they come with an idea. Then this is where the incubation comes into the picture. BioValley or MediValley, I have seen that they provide all the facility with that idea to convert into prototype and later to get scaled up is what this MediValley, BioValley and incubation centers and AMTZ does.
They have first testing labs, which is NABL accredited. That is the most important thing. Second thing, they have a very good regulatory team. They themselves are the certifying bodies who can give ISO 13485 certificate for medical devices.
Develop a device or a 3D printing, you can develop that. If you require some sterilization, then gamma radiation facility is over there. If you require health tech assessment, those HTA department is in picture. If you require market accessibility, those things are in place. If you need to connect to regulatory, those are things in place. If you require financial equipment, suppose the capex funding is provided to you. Infrastructure support is provided to you. So this is like Define Bio is basically a biobank. Rather, I will say a comprehensive biobank, which is a Make in India initiative, which was brought up by a visionary leader, Dr. Jitendra Sharma.
From the first sketch to a product ready for market, the pathway is already built.
They help you with nurturing the idea to a product, and then they also help you with regulatory also. Because for class A and B, they themselves can audit as part of CDSO's approval, and they can give your factory approval for 13485 also. This is, I haven't seen it elsewhere. Dr. Jitendra Sharma they call him as, MedTech man of India. I think he himself is the MedTech Mata. He takes care of you. He has that vision and mission. He's completely into this medical device. And if you come up with a wonderful idea, he will take the product to market. So it will be a win-win situation for everyone.
For startups, the challenges were always the same: infrastructure, regulation, capital, and access to market.
AMTZ system has really put in operation a wonderful model where right from supporting the companies, right from making the whole process free of all the red tape, it can get into operation because of the ecosystem in a record time. But Dr. Jitendra Sharma has shown what is possible within the framework of all laws, regulations and issues. You have to know how to handle these issues in a manner which does not hurt the system, but at the same time you achieve what you want.
AMTZ is an institutional aggregator. What does an aggregator do? An aggregator brings in various functionalities needed by the sector as institutions. AMTZ has done exactly that. We brought in the Kalam Institute of Health Technology, which is the central policy support institution for Government of India in the field of medical technology. The Bio Valley, which is a biologics and diagnostics incubator under Ministry of Science and Technology. The Medi Valley, which is a medical electronics and biomedical incubator under Niti Aayog support. An ICMR center, Ministry of Electronics Center for Additive Materials, Ministry of Electronics Center for Component Production and Electronics. So we have created a bundle of institutions together to ensure policy support, standardization, validation, supply chain is all factored in our mission. We have also brought in a WHO Center for Health Innovation. This is the only WHO center on health innovation globally that takes care of our international reach and our support to WHO on health technology projects and innovations. We have also brought in World Trade Center. World Trade Center helps us in business connectivity across the world. And therefore, as an institutional aggregator, we have been able to bring together large number of institutions who play a role, a pillar, a support in the mission of AMTZ, which is dominance of India in medical technology to supply medical technology products to the country and also emerge as global leader.
What began as an emergency response evolved into long-term capability. This wasn't accidental. It was a deliberate strategy to build scale through collaboration.
And that was how the whole thing started. And since then, it has been a wonderful journey. We shared a lot of, shared dreams, common goals. And from ventilator, we moved into more complex projects like a CT scanner. And along with AMTZ, we were very proud and very privileged to have been working on a project where we developed the first CT scanner in India.
We are hoping that in next 3 to 4 years, we would touch about 40%. So AMTZ touching 40 to 50% of Indian medical devices market is first goal, and making India import neutral in medical technology is our second goal. And we seem to be on track numerically towards those goals.
Starting from regulatory to bringing the idea to a product to the market, everywhere AMTZ was really useful to us.
Because today medical technology is a very important part of healthcare. You cannot imagine healthcare without medical technology. So I'm glad that I'm part of it. I'm part of what we call making India healthy and happy. In many ways, AMTZ is a unique industrial park. I would say, if not in India, at least in Asia, I think it's a unique one. Very rarely you find a industrial park where you get so many amenities and so much support. Now, typically in India, the industrial park means they give you a piece of land, that's it. Rest is all yours. But not so here in AMTZ. AMTZ, you get full support in not only getting the government licenses. I don't think of any other industrial park in India that offers you all these support. And I think this is why Dr. Sharma wanted to have a university in AMTZ, a university that can encourage and build the ecosystem for research.
True self-reliance begins when a nation builds what it cannot live without.
Any enterprise, if it is by and large a private sector, profit-oriented enterprise, must look at return on investment. A public sector institution like AMTZ, which has been created to make India self-reliant in medical technology, must also look at ROS, return on society. The men's wheelchair basketball team and the women's wheelchair basketball team, the two national teams, have been adopted by AMTZ.
थोड़ा सा बैकग्राउंड में जाऊंगी मैं बिकॉज मैं मुंबई से हूँ, आप जान सकते हैं मुंबई बड़ी सिटी है, वहाँ पे भी हमारे लिए बास्केटबॉल कोर्ट नहीं है, इंडोर भी नहीं है। सो वहाँ पे हमारी प्रैक्टिस नहीं हो रही है लास्ट 2 साल से। और आपको आइडिया है कि अगर हम प्रैक्टिस नहीं करेंगे तो मैच कैसे विन करेंगे, बिना प्रैक्टिस के तो पॉसिबल ही नहीं है। अभी WBFI का जो कोलैबोरेशन AMTZ के साथ हुआ है और डॉक्टर जितेंद्र शर्मा सर ने जो सपोर्ट दिया है, मैंने मेरे इतने सालों के करियर में कहीं नहीं पाया है।
The Indian team women's coach, the teams were unhappy because we used to just conduct the national championship once every year, and after that we never met till the next nationals.
MTZ मेरे लिए आज एक बड़ा प्लेटफॉर्म है जहाँ पे हमारे लिए एक इंडोर स्टेडियम है, हमारे एक्सेसिबिलिटी के लिए वॉशरूम्स है, एक्सेसिबिलिटी का हमारा स्टे है जो हमें स्टे दिया गया है, सब एक्सेसिबल है।
They stay with us. They have a homegrown court here. Their only home court in the country is at AMTZ, a very unlikely place for a wheelchair basketball team to make a science cluster its home court.
Now we are having 4 camps for women and 4 camps for men this year at the AMTZ. So our players are very, very happy. We are very grateful to Dr. Jitendra Sharma, founder MD and CEO of AMTZ.
We have built the court for them. Why? These champions are also users of our prosthetic limbs. And AMTZ has a prosthetic limb center. We make a prosthetic leg for less than 4,000 rupees. We make solar-powered wheelchair. We make sports wheelchair. We have done well by attracting hundreds of companies in this zone, and we do at least one addition to our AMTZ family every week. Almost every week. And therefore, AMTZ's goal by 2030, next 5 years, would be to touch a cluster turnover of about 25,000 crore. So that we can proudly say that at least 30% of Indian medical devices market is served by AMTZ.
What began as an industrial vision has grown into something far greater, a place where ideas become products and products become impact, where startups find support, industries find scale, and a nation finds confidence in its own capability. But beyond technology, the impact reaches further, into communities, into education, into lives. From supporting the national women's para basketball team to building institutions that nurture the next generation. This is not just about manufacturing, it is about building a system that serves society.